an important topic, that is cardiac cycles and heart sounds. So basically, cardiac cycles is nothing but the entry of blood into arteries and exit of blood from the ventricles. So this is the contraction and relaxation. Contraction to the relaxation, this is one cycle. Okay. So this all about we will discuss in this chapter. So basically the cardiac cycle is the sequence of events in one heartbeat. So if heart pumps, so what will happen? Okay, this is called cardiac cycle. Okay, this is called cardiac cycle. So basically we have two arteria and two ventricles. So first two arteria contract and two ventricle relax. Second, when ventricle contracts, arteria relax. Okay. So basically, what is the term we use for contraction and relaxation? This is very important. So you have to remember that those two terms. One is systole and another is diastole. Systole is contraction. Okay. Systole is contraction. Diastole is relaxation. Systole, contraction, diastole, relaxation. So this is the one cycle. You are probably familiar with this terms as applied to the blood pressure reasons. Okay, basically this is also known as blood pressure. 120 by 80 is the normal blood pressure for every uh, person. Okay, so 120 is systole and 80 is diastole. 120 is systole and 80 is diastole. 120 is systole means contraction. 80 is diastole, is relaxation. So pressure is needed for contraction. For relaxation, that much pressure is not needed. So first, that's the reason 120 is the pressure of heart for contraction. Okay. So here is arterial systole is followed by ventricle systole. Means first arterial contract, then ventricle contract. Means it is opposite. Arterial, this is arterial, this is ventricle. So first arterial is systole, means it is contract. Then ventricle contract. Okay, when ventricle contract, arterial is relax. When arterial is contract, ventricle is relax. Okay, so this is the so we have to remember this arterial systole and ventricle systole, arterial diastole, ventricle diastole. Okay. There is, however, a significant difference between the movement of blood from the artery to the ventricles and the movement of blood from the ventricles to the arteries. The events of cardiac cycles are shown in figure 12.5. So basically what will happen, arteria and ventricle both contracts. So from the, this is the thing that this is the art, arteria. Okay, this is the ventricle. Okay, we have chambers, four chambers. So these are the vein, pulmonary vein, aorta is the pulmonary artery. Okay, sorry, pulmonary artery is here. Superior vena cava, inferior vena cava. So bell will come into the auricles, then two auricles in when relax, and it will release when contraction of ventricles happen. So there is the much difference in the timings. Here is the timing is given. Okay, so here arterial systole, first start with arterial systole. Okay, first arterial systole will happen, means contraction happens. Then what will happen? Then we have two valves, tricuspid valve, bicuspid valve. So anterior ventricular valves open, Okay, then blood will enter into the, so I think this is the cycle is so confusion. So I will explain. First, we will do the theoretical part, then we will discuss practically. I will explain. So basically, in this traditional representation, the cardiac cycle is typical in a circle because on one heartbeat follows another. And the beginning of atrial systole is at the top 12 o'clock. The size of the segment of the circle indicates how long it takes. Find the segment of arterial systole and the one for ventricle systole and notice how much larger, meaning longer ventricle systole is. Do you think that this might mean that ventricle contraction is more important than atrial contraction? It does, as you will see. We will begin at the bottom 6 o'clock. So basically here cycle is there. So basically I will take one. So basically this is the so basically this is the atriums. This is the ventricles. Okay. So here what happened that when atrial atrial systole, atrial systole, ventricle systole. You have to remember these words: atrial diastole, ventricle diastole. So here what happened? There is a difference in timings when atrium contract, ventricle relax, ventricle contracts, atrium relax. Okay, so basically we have to remember this things. What happened when atrium contract means atrial diastole happens. Okay, what will happen? Contraction happens. Here, tricuspid valve, bicuspid valve, AV valve open. Okay, AV valve open. Okay, AV valves open. AV valve opens, the blood will flow into the ventricles. Okay, so what is the timing? We have to remember that within 0.1 second. How this is happening? Within 0.1 second, AS will happen. This is the thing we have to remember. Within 0.1 second, atrial systole will happen. Okay, then blood will reach into ventricles. So this is now blood reach into ventricles. This is the atrial diastole. This is the atrial diastole. Now these valves are closed. Now blood reach into the ventricles within 0.1 seconds. Now ventricle contracts. So ventricle when contracts, okay, ventricle systole will happen 0.3 seconds. 0.3 seconds. So this will take some more duration than atrial systole because this is the large capacity and you have to send the blood to the all parts of the body. Okay, and it will take some contraction. Atrial ventricle systole, ventricle systole will happen in 0.3 seconds. Now what will happen? Atrial diastole is there. Atrial after atrial systole, what will happen? Atrial diastole will happen. Then only ventricle systole will happen. Okay, ventricle systole. So atrial diastole. What is the atrial diastole? This is for 0.7 seconds. What is the duration for? 0. This is 0.7 seconds. Atrial diastole. Okay, ventricle diastole 0.3 seconds. Atrial systole 0.1 seconds. And atrial diastole for 0.76. Now is the ventricle systole is done. Now ventricle diastole. What time is ventricle diastole is taking? Ventricle diastole will take 0.5 seconds. How much time? 0. Ventricle diastole 0.5 seconds. Okay. Now what will happen? Now we have to open. So basically, I think you understood that this is the cycle. Okay, atrial systole followed by ventricle systole, atrial systole, ventricle systole followed by atrial systole. So this is the duration in which the chambers open and the chambers close and body will reach to the body. Okay, so how much one beats take? 0.1, 0.3, 0.8 and 0.8. Correct? 0.1 second, 0.7 seconds. 0.8, 0.16 means it will take 0.16 means not into 60. So in maximum 1 minute we will have 96 heartbeats. 0.1 second. Hey, but person to person it differs. Okay, some persons have 0.14, some persons have 0.12. So according to that, the heartbeat is represented. So I think you understood this is the cardiac cycle, which is explained. So the important distinction here is the most blood flow passively from atria to ventricles, but all blood to the arteries is actively pumped by the ventricles. For this reason, the proper function of the ventricles is much more crucial to survival than is arterial function. So here we have to remember that more than arterial function, ventricle function is more important because the flow of blood from the ventricles to the body is depend upon the ventricles only. If the valves have any problem, okay, if any this is the valve, okay, if any valve is problem, okay, then what will happen? The blood from the ventricles could not easily pass to this artery, so it will stored here only. Pulmonary artery, sorry, pulmonary vein or aortic vein. We have semilunar uh, valves. Okay, so this is the most important. You may be asking, all this is in one heartbeat? The answer is yes. So I told you that in 0.116 seconds we have one heartbeat. Means arterial contraction will happen, ventricle relaxation will happen, ventricle contraction will happen, arterial relaxation will happen. Okay, this is the thing we have to remember. Okay, the cardiac cycle is the precise sequence of event that keeps blood moving from the veins through the heart and into the arteries. So the blood will. So again, I will explain you because it is very important. Okay, so this is the four chambers, atrium, ventricle. We have superior vena cava, inferior vena cava, superior vena cava, blood will come from upper side. Inferior cava, blood will come from lower side. We have pulmonary vein, we have aorta here. Here pulmonary artery is there. Okay. So here, sorry, this is the pulmonary artery. This is the pulmonary vein. This is the sequence where pulmonary artery will taking venous blood, deoxygenated blood. This is the sequence as pulmonary vein taking oxygenated blood. Okay, this is the thing. Reciprocal here only, not in other parts of the body. Okay, so this is very important. This is the valves, like semilunar valves are there, AV valves, tricuspid valves, bicuspid valve we have, and atrioventricular septum and uh, ventricle auricle septum. Okay, and they have the three pericardium, endocardium, myocardium. Okay, and this is the thing we have to remember. And low and inside the heart there is the chambers are have layer with endothelium, because the blood clot will not happen. Okay, so this is the thing we have to remember. So then after cardiac cycles we have heart sounds, means heart contract, relax, heart contract and relax. So this is where we hear heart sounds. What we hear? We hear heart sounds. So basically we have four heart sounds, but but basically you have four heart sounds. The heart sound is named as S1, S2, S3, and S4. So basically S1 is S2 can we hear with our stethoscope. S3 and S4 need more depth uh, s- meter or stethoscope or different types of stethoscope out there. So we will able to listen from that uh, things only. Okay. So basically we can hear two heart sounds, that is S1 and S2 with our stethoscope. So what is the lub? The sounds you can hear lub dub, lub dub. So this is the heart sound you can hear. Okay. So the first sound is very large. Whenever the heart contract, we need more friction or more energy. So the first heart sound is very hard. That is lub is caused. How that sound is caused? Because of the ventricle systole. Ventricle systole. What will happen? AV valves will close. Tuck, lub, lub. Okay, lub. So this is the close of AV valve. If you hear dub, it is means the close of aortic and pulmonary semilunar valves. What is the sound of pulmonary and aortic valves? That is dub. So lub means AV, closure of AV valves. Dub means closure of pulmonary and aortic valves. What will happen if the closure of valves is not happened properly? So we can hear murmur sounds, heart murmur sounds. What we can hear? Heart murmur sounds. Okay, so this is the abnormal sounds of heart because of unclosure or not closing of valves in the heart. Okay, so this is the thing we have to remember about cardiac cycle and heart sounds. So I think you understood about that. If you have any doubt, you can ask. Next, we have cardiac conduction pathway. How the cardiac is conducting, how his heart pumping. Okay, this is very important.
No doubts, sir. We'll move on.
No doubts.
Yeah, no doubts.
Okay. So basically, cardiac conduction pathway is it will take more time. Okay, I think we will discuss heart murmur only. This is the box is given. Let's talk about heart murmurs. Heart murmur is an abnormal or extra heart sound caused by malfunctioning of heart valve. So you can when you went to or any patient went to cardiologist, what will he will do? He will put the stethoscope and he will check the heart sound. Okay, so if any uh, abnormal heart sounds are listened by him, so what will he will do? Whenever we do cardiac examination, we will write CVS. CVS means cardiovascular system. So in that particularly, we will examine heart, the heart sounds. First step, whenever cardiac patient will come, we will listen heart sound. If the if we put our stethoscope at apex region, I told you na here. This is the space where we can listen heart sounds. So apex region, then you can go to upper side of the chest, heart, atrial, ventricle, whatever you need. This is the heart position. So this is the heart position. Okay, so you have to listen apex. Here is the apex. Okay, you have to listen heart sound here first. Then you can rotate the stethoscope in and around the heart. So what will happen? You will listen uh, some malfunction of the heart. Yeah, some like disturbances sounds, not lub dub. No, so why this is happening? Because of the valves. Most of the problems is present in the valve. So you hear that the patient have triple valve disease. Okay, triple valve disease means all the three valves which are present in the heart are not functioning properly. Okay, so what will happen? The blood flow is disturbed because the heart have to pump the blood forward. You have to collect and give to the body parts, but it is storing the blood in his place only. He cannot able to pass forward. Okay, it is unable to pass forward because of the damage of valve, and that the valve are unable to open properly. It is not open, not closing properly. So that's the reason the blood will stored in heart only. So what will happen? Heart size will increase. Okay. So, but in some cases also, in some infectious cases also, the valves are damaged, like rheumatic heart disease. This is now uncommon condition, rheumatic heart disease. Rheumatism, RA factor, which is autoimmune disease, what allopathy said at himself. Okay. It will happen heart. The valves are damaged. Okay. So it will not empty the blood from the heart. So we will see mitral valve regurgitation. Means bicuspid valve. Mitral valve, this is the valve. You can see here. So this is the mitral valve. Bicuspid valve, also mitral valve, tricuspid valve. Okay. Mitral valve regurgitation. So if unable to open or have some disturbance, what we call term mitral regurgitation. Okay. For example, will be here a systolic murmur. Systolic means contraction. While lub, ventricle contraction, what will happen? Unable to hear clear voice picture of the heart. Why this happen? Because backflow during ventricle system. What is the function? The valve will stop the black flow of the blood, but here blood flow is happening because the valve is not opening. So will sound regurgitation. Grrr. What the difference sounds, but here what will happen? The backflow is happening, so we'll hear some resound will happen. Something, some in some cases, this is a rheumatic heart disease. In some cases, we have stenosis, means narrowing of the blood vessels. Mostly in this is congenital. By birth, disease is seen. Okay, or aortic stenosis. Okay, and these are the conditions where we hear heart murmur. Aortic stenosis means the aortic, whatever aortic artery is there, large artery is there, the narrow of aortic valve or artery will seen. So what will happen? The pressure will put upon the aortic valve. Okay, so that's murmur sounds are heard. Okay. Children sometimes have heart murmur that are called functional because no structural cause can be found. These murmurs usually decreases with no adverse effect on the child. In some cases, during birth, we can see the murmurs, but later stage, how the baby begins, the baby uh, size and weight and improving is seen, the murmur is also gone. Okay, so this is the very important. Heart murmurs are seen in valve disease, like mostly in rheumatic heart disease, which will attack on the valves, and aortic stenosis. This is also the condition, and something congenital also is there. Okay, so this is the important thing we have to discuss. Cardiac conduction pathway we will discuss tomorrow. Okay.